As a father, you try to protect your sons, and there was nothing that I could do as their parent to take away the loss of their own flesh and blood from them.
Speaking to us anonymously, Tahir's dad tells me his son had come out at university and embraced his identity with pride. A confident, openly gay man, his reputation was everything to him. But underneath Tahir's shining exterior, he'd been seeking help for an addiction.
It was the Monday, the start of the week, and I got a call saying my son had gone missing.
Tahir had met with a man he'd known for a number of years and engaged in chemsex. But after a number of days using the drugs associated with this type of sex, an ambulance was called.
They got to the property, it was dark. They walked into a place which they described as being in disarray. The place had what looked like Class A substances at the address. They found my son on the floor, lying on his back, with a towel on him.
His body had laid undiscovered for 17 hours. He was just 27.
To spend his last hours with no one around him to care for him, just left on the floor in a blanket. I don't know. I feel like I let him down. It's not as a parent. It's not what you're meant to do. You're meant to protect them. You're meant to be there for them, and we couldn't be there for him. And feel a strong sense of failure.
Tahir had crystal meth, GHB and ketamine in his system when he died. Did you even know what chemsex was at this point?
I was able to find out that this was a scene that he'd been involved with as a teenager. He got some help and took some counselling and was able to wean himself off that scene.
Just a few weeks before Tahir died, he went to seek help again, but it was too late. Tahir left behind a heartbroken father, suddenly pushed into a world he never knew existed, struggling to make sense of the unimaginable. You've possibly never even heard of chemsex, essentially the use of illegal drugs to enhance sex. The most concerning involve crystal meth, also known as Tina. It's a Class A substance. It's used to induce euphoria, but its darker side brings paranoia and psychosis. Then GHB or GBL, also known as G, a potent Class B drug. It makes users feel drowsy and relaxed, but it's very easy to overdose, as just a milliliter too much can be fatal. We found chemsex-related drugs have moved further into the open, no longer just as tools for sexual encounters, but as recreational substances drawing in a number of gay, bi and men who have sex with men. While these drugs are more prevalent within these communities, it's important to say they're used by smaller pockets within these cohorts. But for some, as we're about to learn, these potent drugs offer an escape from deeper struggles, mental health challenges, trauma and the weight of marginalisation. Saturday evening in London. We're spending the night with Peter Kingsley, an advanced paramedic. We're called out to a potential drug-related case.
Heart rate's 120.
But this isn't the kind of drug use Peter has been looking into. Have there been any cases, particularly regarding chemsex, that have really stuck with you?
It was an incident where two guys had a sort of a fairly sort of lasting relationship. They'd meet up every so often to take drugs and have sex. And it all came to a head on when the guys got together at one of the flats. One of them overdosed. He collapsed and he became really, really unwell. And as we're moving him towards the ambulance to take him off to hospital on a blue light transfer, we left the other chap sat on his sofa in his boxer shorts, physically shaking from the shock and the stress of what had just happened. And I think as I came and sort of reflected on that, I thought, well, we didn't do anything at all for the other chap. The one that's unconscious clearly is always going to get the focus of all your attention. But was there something more that we could do?
As a result, and in an effort to reduce harms, paramedics in the city now give out resources when they respond to a case for people's future reference. Back at the ambulance centre. So this will be where you can see all of the incoming calls that are coming into London.
Yes,
right?
That's right.
In this room, they'll resource some of the most serious call-outs. Those cases can often be related to chemsex when it's gone seriously wrong.
We've done some very rough data, super rough data, and we know that we attend at least one call-out every 24 hours. My own view is that it's higher than that, but we have to do the research to actually confirm that. So the short answer is we don't know. We just don't know.
So obviously there's going to be an element of sort of shame, I suppose, and feeling embarrassed, I guess,
Yep.
at being a chemsex party or having been with someone who's overdosed on these drugs. But what you're saying is you're not there to judge.
And you can hear it in their voice there. There's uncertainty about whether they're doing the right thing. There's uncertainty about what's going to happen next. There's that concern for the person who's collapsed, but there's also the concern for everything else that sort of can go with that. And people are often quite nervous. We're not here to judge. We're not here to make any comments on how people have got themselves into that situation. We're just there to help out.
Just because we're using the word chemsex, it doesn't mean these drugs are always used for sex.
I have scars all over my body. I don't know where this came from. I have no idea how I got them. And that's crazy to be covered in scars and not know the origin.
The scars Christian talks about appeared after blackouts. That's when a person falls unconscious after overdosing on G. For Christian, though, they didn't use these drugs for sex.
A lot of things happened in my life. I got a divorce. I moved out of my home and I went to live on my own. I left my job and I went freelance. My mental health had been bad for some time, so I guess it just all sort of coalesced and I started using G. Just started taking more and more and more.
G became a bit of a crutch for you.
There was one incident where I just completely overdosed. The police had to knock my front door down and they found me unconscious. And I was taken to the ICU and put in an induced coma. My mum sat for 48 hours by my bedside holding my hand.
What for many would have been a wake-up call, Christian continued to spiral.
There's no logic in your brain. I've had many, many visits to the hospital since because I started introducing meth to the mix. That led to a lot of trips to A&E and a lot of drying out in hospitals. Led to me being sectioned at one point. Crystal meth is evil, and its destructive capability, not just on your life, but on your mind.
Christian escaped with their life, but we know that's not the case for many others.
I am so sick of opening a social media app to learn that young gay men are dying. When it's not affecting straight people, particularly straight white cis people, then it's sort of seen as an over there, that it's happening over there. Doesn't matter what circumstances, chemsex or just, like me, sitting there abusing it at home. More and more people are dying and nobody's talking about it.
Christian was admitted here multiple times. King's College Hospital in London, one of the busiest in the country.
Hey Naomi, you okay?
Dr. Naomi is a specialist consultant in sexual health, a healthcare professional extremely well versed in the nuances of queer healthcare. She's seeing the direct impact of G and crystal meth on her patients.
Roughly about 30% of all the drug-related admissions are due to these drugs.
That's almost a third of drug presentations in King's.
Yes.
I think a lot of people would say that's quite a big...
Yeah. This is a really significant problem that's particularly problematic in this locality. I think it's a reflection of the extent of the problem, which perhaps for a long time has slightly gone under the radar, and you know, perhaps the fact that it's been associated with the LGBTQ community means that it's been slightly normalised, and that's incorrect and not right.
The NHS uses codes for drugs like alcohol and Class A substances. It means they can track data and put money towards various issues. That's not the case for the likes of G or crystal meth.
When something is coded, it requires money. And that money will then be put towards remedying the issue.
Exactly.
But we're not coding it, which means there's no money going towards the issue.
That's correct, in that the way that the NHS gets paid is via the codes, and so without a specific code for this issue, it is still kind of going under the radar somewhat, and there isn't enough money for us to deal with it effectively.
Do you think you need that money to effectively treat the patients that you're seeing?
Yes.
So you would like the NHS to start coding for these specific drugs?
I would like the NHS to start coding for these specific drugs. I would like the NHS to understand the complexity of the issue and how much resource is required to look after these people. I would call on society to start looking at addiction with a more sympathetic and understanding lens. I can only speak about this hospital, but I would imagine it's similar elsewhere.
We've come to Manchester to meet Tiffany.
Just makes me feel just so sad, you know. I said before, there's such a massive void in my life since Jay's gone. It'll never be filled, so, you know, knowing that I've lost him to something that could have been prevented is just devastating.
Tiff lived here in Manchester for a number of years with her best friend Jay.
So that's Jay.
Yeah.
And that's...
You both like tattoos?
Yeah. And that was like when we were living together.
Jay had a lot going on in his life. He'd never struggled with addiction, but when COVID hit, he was overwhelmed.
Extended periods of isolation and the loneliness, and obviously the financial implications that it had on his business. And then, you know, he lost his dad, he lost a really close friend to a tragic accident, and I think it just all escalated and really impacted his mental health, which led, I think, to a desire to have some form of escapism, and some form of escapism manifested itself in him exploring the chems, where it became, well, it started off recreationally and then it became habitual, and then it completely took over his life. You know, it transpired later that he was having to take it on, you know, every couple of hours just to be able to get through the day. Yeah.
So that's like throughout?
That's sort of throughout a 24-hour period, yeah. So it literally, the addiction just tore through his whole life.
Again, Jay's G usage was never to do with sex. The substance is extremely addictive, and the consequences for Jay were devastating.
When did you find out that Jay had passed away?
I got a call in the morning to say that he'd passed away. The morning of the call was the day that his sister was supposed to get married, and he was supposed to be walking her down the aisle. Sorry.
It's all right. Do you want to take it?
Fine. It's the ripple effect of, you know, the shock, even though you knew that things were getting really bad. Watching someone that you love deteriorate in such significant ways is devastating. There's a J-shaped hole in my heart that will never be filled, you know, and it's the ripple effect of everything. You know, life is no longer the same without him. It's really important that we just do as much as we can to raise awareness, because I never want anybody to feel the grief that I felt, or, you know, everybody that loved him felt.
Tiff now works for the LGBT Foundation in Manchester. Jay's story is not uncommon here.
I think it's got this image that's predominantly a London-based problem, but what are you seeing in Manchester? That's not the case.
We've seen a significant spike in G-related deaths, especially in the Greater Manchester area. Within the LGBT community, it can be quite a hidden thing within the community, let alone outside of there, because of the associations with shame, because of the associations with guilt, because obviously people are taking drugs that are not legal. On the outside world, it's just being ignored.
Why? I guess I like that. That's the one question I keep coming back to with this.
I think it's a lack of awareness, a lack of education, and we're already part of a marginalised group. So if we start talking about illegal drugs and sex, then it's already kind of that stigma that's attached to a community that we already face so much discrimination. It would be added to that. So it's an issue that needs addressing, but not enough people are talking about it.
Psychology report. But that hasn't been done, has it?
No.
Mark is a social psychologist. He founded You Are Loved, an organisation to prevent deaths and suicides of gay, bi and queer men. His main mission is to evidence the potential harms of this type of drug use.
What's come up time and time again is this like almost black hole of data.
And that is precisely the problem. If we can't evidence the issue, if we can't evidence the number of deaths that are actually taking place, then the problem isn't there, right, essentially, and then no one needs to do anything about it. And in that way, you could refer to this as a kind of a silent crisis or epidemic. That is, it's happening, we know that it's happening.
Mark is specifically concerned about G. It is so easy to overdose on the substance and can be fatal, and it's not routinely tested for when someone dies.
It's complex to begin with, to test for GHB in a post-mortem exam. There are many different reasons for why it's complex. So there are a number of barriers, cost being one, so resources being one, which the government has been made aware of.
This was
2020, yeah.
5 years, coming up to 5 years ago.
Yes, in this report that was commissioned by the government, they made a number of recommendations. One of them was that testing needs to be made mandatory to make sure that we don't miss any deaths that are GHB related.
This report was from 2020, but it's not just, it also highlighted a number of different things, didn't it? Nothing's really changed, even though the government back in 2020 had this whole report saying, something's going on here.
Yeah. As far as I know, the only recommendation that they did address was reclassifying GHB from a Class C drug to a Class B drug. Despite us being a small minority, if you look at the wider data, that's a small number of people using these drugs. But if we look just in our community and the people that are in our community, that's a relatively high number of people. The underlying factors, in my opinion and professional opinion, have to do with stigma, discrimination, loneliness, shame, factors that influences our community. By all means, it influences the general population to a certain extent, but perhaps our community disproportionately.
One police force trying to tackle the issue of poor data is the Metropolitan Police. I'm meeting with Inspector Alan Davis. The police reported in 2023 official figures showed that chemsex claimed 3 lives a month in the capital. But the Met Police told ITV News they fear official figures for 2024 will be the highest on record.
People are dying. Young men are dying. We have to do something about it. I don't want to have to come into work to deal with another chemsex context death, to have an appreciation of just how many underreported rapes there are in this space. The fact that people don't have the confidence, or they think that they're not going to get an effective response from a police service or from the wider sort of criminal justice system because they don't think we get it. Yes, we do get it.
Chemsex isn't a crime, but Alan's team have picked up on the nuances around chemsex, which means they can illustrate the crimes existing in this context. For example, in 2023, they were made aware of 380 suspected crimes, majority being violent or sexual offences. But when we approached other major police forces from cities across the country, they provided us with very little data when it comes to quantifying the issues.
There is a historic distrust from many gay and bisexual men towards the police. If you are so far ahead, it doesn't give me much hope what is going on outside of London in terms of how police forces are dealing with it?
I think what I'd say is that knowledge is power. It's around sharing that knowledge and understanding with others. It'd be homophobic not to be able to sort of shine a light on actually what's quite challenging, difficult issues, having the confidence to talk about sex, sexual orientation, around drug use, because it is complex, because it impacts on a subgroup of a minority community. But the harms present in this space are extreme. They're not going away. And we have to look at the impact that these two particular drugs are having on the cohort of people involved.
Tahir was just one in that cohort who paid the highest price, something his dad thinks could have been avoided.
If we were in a position today and people did understand that this is a complicated world, and there was more awareness around the dangers of chemsex and less judgment about chemsex, do you think Tahir would still be here?
Undoubtedly. I lost my son. When people talk about chemsex, it's squalid and it's sordid, the way it's described and thought about, which for someone who's trying to guard their reputation is hardly going to encourage them to get some help. It seems to me that he stepped into a world where there wasn't the help and the support that he needed. A lonely, desolate way to go.